You know, we're all watching the Affordable Care Act underperform, and we're all concerned that what it sought to achieve, one would say it at least partially achieved. There are millions of people on the plan, but let me go through a couple of comparisons. Then they're a little outside your briefing, but I think they're well within your competence. You're personally under FEHBP, right?
That's correct.
And you're familiar with the programs that are offered, the 250 plus different options.
Nationwide, there are many, yes.
So if we were to contrast the 11 million plus people that are in FEHBP, that are federal employees, retirees, and their families, contrast the options between what you expect to have in 2017 in the Affordable Care Act as it is, and what half the number of people, but the federal workers and their families have.
Thank you. Right. About 8 million people covered through the Federal Employees Program, as you mentioned, nationwide, over 200 plans offered. That includes some national plan offerings, mostly PPOs, as well as local HMOs that are available in specific markets.
Right, to include Kaiser, Blue Cross, all the major names.
That's correct. And so throughout those markets, federal employees, retirees, and dependents can choose either from those national plans, the largest by far of which is the Blue Cross standard and basic options, which covers about 2/3 of enrollees.
And under the plan, if you go onto a COBRA, because you leave the federal workforce, you pay to whichever health care program you were in as you continue, right?
COBRA would have continuation coverage paying, with individual paying the full premium, a small admission.
Right, which means at least in some cases, the health care providers accept a check from an individual.
In the COBRA cases, yeah, I don't know the actual transfer of the money, but it would be coming from the individual.
But in all cases, essentially, these are private companies who have made a decision to provide a program to whatever amount of people, if you will, any and all from the federal workforce, current or in the case of COBRA, that choose their plan, correct?
They are private plans, yes.
And just going through a couple of points, they're not gender discriminate, right?
It's available to all federal.
But they charge the same rate regardless of age.
Same premium nationwide.
Right, so you take advantage of the pool that you're not worrying about whether you're young or old, man or woman, the rate's the same.
It is one premium
right.
for all.
And your 26-year-old child can stay on it?
Up to age 26.
Or 27th birthday, whatever.
The 26th birthday rate.
26th birthday. And there's no problem switching as a federal worker from program to program on an annual basis based on any pre-existing conditions or any other discrimination.
Yeah, during the open enrollment period or for special reasons, they can change plans.
Okay, so it's fair to say that FEHBP with 200 and some, my number is 250, but a great many plans, more than the Affordable Care Act in most areas, in fact, offers all the same protections to the consumer that the ACA handles, right?
My understanding is that the plans meet the requirements of the Affordable.
Okay, and they come in all levels, from relatively stripped down to essentially the equivalent of very large plans like the postal plan, which is a pretty good one, and so on, right?
They're all comprehensive medical. Some are high deductible offerings, and some are HMOs, yes.
So I've gone taking you through this and taxed your expertise for a reason. Is there any reason that if the Affordable Care Act were to go away and a transition to enjoying the same programs offered to the federal workforce, to virtually everyone who now or has retired from the federal workforce, is there any reason that that wouldn't be viable, considering these are insurance companies that want access to those 8 million plus people they now insure? They bid for it every year, and if the number were increased, both for individuals and small or even not small businesses, is there any reason to believe that the program inherently wouldn't be able to serve the same purpose, especially considering at least a subset of FEHBP are in fact the same companies?
Yeah, GAO has not kind of evaluated expanding the federal employees program to other plans or offerings. It is an employer-based plan based on the group of federal employees, retirees, and that's kind of important for that risk pool, as there's not risk adjustment, other issues, and so.
Well, there is risk adjustment because they bid annually based on the risk, right?
It's based on their experience, yes, but not, if different plans end up with different risks, that's.
Right. Well, I mean, if over time the federal workforce gets older, sicker, whatever, they adjust.
Yes, it would be based on that plan's experience.
Okay, so last question, if I may, Chairman. You know, it was not considered originally, but they are private programs. There are more plans. It enjoys all of the same protections of the Affordable Care Act. So when people, and I'm not trying to be partisan, I'm trying to be very open here against what do we do in the eventuality, there is no inherent reason that you couldn't have the federal government insure through these national contracts with local and not local companies. There's no inherent reason that that couldn't be offered as a viable alternative, recognizing that there is a risk pool change, but these companies start off with an incredibly desirable 8+ million people that they're not going to want to walk away from if others are allowed to join.